Health Day, which is, of course, being marked today under the theme, Our Planet, Our Health. South Africa has a problem with air pollution and is ranked number 39 globally in the pollution statistics. To tell us about what people can do to protect themselves from the harmful effects of air pollution, I'm joined by Malcolm Rosewall from Solenco South Africa. Malcolm, good afternoon. Thank you very much for your time. I guess I could say Happy World Health Day. But the quality of air affects our health. Sometimes we don't think about it all the time. A little bit earlier we were speaking about non-communicable diseases, the rise in that, because there's been a lot of focus worldwide on the coronavirus pandemic for 2 years, and we've sort of forgotten about the other diseases. But health is also linked to the air that we breathe.
Indeed. Hi, Dan. How are you?
I'm fine.
Good. Okay, to start off, the World Health Organization has described the air quality in South Africa as moderately unsafe, which is concerning to say the least. Our concentration of PM2.5 air particles, which is basically the microscopic particles that we breathe, particles about the size of smoke, is more than double what the World Health Organization believes is the maximum. So we are double what the maximum allowed measurement of PM2.5 air particles in the air. Air quality, as you mentioned, in South Africa is poor, to say the least, but notably in areas that are highly or densely populated, like Gauteng, for instance. Greenpeace recently mentioned that some of the largest hotspots in the world are in South Africa, Mpumalanga being one of those, with the largest nitrogen dioxide emissions on the planet, and the second largest hotspot for sulfur dioxide globally. Obviously, this is extremely toxic, and we're breathing this in every day. It's reported that about 7.5% of deaths in South Africa can be attributed to poor air quality. And some of the larger contributors to these are the mining industry, power plants, burning of coal and oil, and even seasonal forest fires around Jan and Feb also contribute heavily to this.
Yeah, and just to think about it, I mean, that means those diseases, your health will be affected in terms of respiration. For example, you think of incidents of asthma. You've mentioned that it's because of industrial pollution in the air, the coal-fired power stations and stuff. So those are the major sources in our country of air pollution.
Yes. And I mean, these affect people at different stages of their lives. For example, in older adults, air pollution can induce things like heart disease and stroke, can cause heart palpitations, chest pains and shortness of breath, lung disease such as bronchitis and other lower respiratory issues. Some other concerning effects to pregnant women and unborn babies, for instance, are linked to, or this prolonged exposure to this air pollution is linked to reduced birth weights and premature births. Young children also extremely vulnerable as their respiratory tracts, their immune systems, their lungs are still developing. And obviously they play outdoors and are a lot more active than us adults and are breathing in this pollution at a higher rate. And it must be mentioned as well that, I mean, we're going into winter now, and the situation is made worse as this dense cold air actually traps pollution instead of just allowing it to be whisked away. And then this hangs around and we're breathing in even more. To top it off, we close ourselves up sort of indoors to keep warm, trapping all these pollutants inside with us. And it's been shown that often that indoor pollution is actually worse than outdoor pollution.
Yeah, you know, we talk about winter coming. I notice every time there's a smell that hits the air in parts of Joburg as you get closer to winter. You don't smell it at any other time except as the wind changes direction and brings winter and those cold air coming from the south, from the Cape. And then you can feel that smell. I think it comes from fertilizer plants or something like that. I have no idea. So in your view, I mean, what can be done to make sure that we breathe cleaner air over time and live healthier lives, and we don't get those heart palpitations and complications that you've mentioned as we get older, for example?
Dan, unfortunately, we're limited to what we can do about the outdoor air pollution, but we certainly can control the level of air pollution in our indoor spaces. our homes, our bedrooms, our classrooms, our workspaces and offices. And we can do this by getting ourselves a good air purifier to contain or to remove those particles from the air in our homes and in those workspaces. I think when choosing an air purifier, we need to find one that has a fan that's strong enough and one that has a decent filtration system, preferably a multi-filtration system, something that has a HEPA filter, preferably an H13 HEPA filter, to remove those ultrafine particles like dust and pollen, mold spores, bacteria and viruses, and then something that has an activated carbon filter. Activated carbon is essentially charcoal. It's extremely porous and will absorb chemicals that are coming in from outside, that outdoor air pollution that's being trapped indoors, as well as other chemicals that are being released by everyday cooking with oil, our deodorants, formaldehyde being released by our new furniture and our flooring, and cleaning detergents, etc. All of these build up in our homes, and we need to ensure that we're not breathing this in at the levels that we are to try and avoid getting these diseases, unfortunately. I mean, yeah, skin irritations, itchy eyes, sore throats, amongst other things.
Yeah, you mentioned some very interesting stats at the beginning of the interview and from different sources. From that research that you have access to, that you were referring to, is our air pollution, is the quality of our air in South Africa just generally getting worse?
It seems to be getting worse, but I think people are getting educated on how to look after themselves in the environment that they can control, and that is the workspaces, their homes, etc. I'm sure the governments have put steps into place. I read an article recently that they have. The Department of Environmental Affairs are taking some steps, but who knows how long that will take.
Okay, thank you very much for your time and your views. Malcolm Rosewall from Solenco, South Africa, on World Health Day, just talking about the quality of the air that we breathe and how it affects our health and what you could do in a small way in your own spaces to try and breathe some clean air now and again. Okay.